Welcome to Upticks with Jake Falcon, founder and CEO of Falcon Wealth Advisors. In this podcast, we help high net worth individuals overcome financial complexities. We do this by enhancing financial literacy and discussing topics in a language free from industry jargon. Join us as we help explain exactly what having a solid financial plan means, as Jake draws from years of experience in helping hundreds of individuals get financially organized and focused on their goals. We hope you find Upticks educational, entertaining, and shareable. Now, on to the show.
Welcome back to the show. This is episode 220, Healthcare as You Plan for Retirement. Caprice, thank you for joining us on episode 220 of Upticks. How are you?
I am doing very well, and thank you again for inviting me. I look forward to these podcasts.
Yeah, well, we love having you on the show, and I know you just recently were on Corey's show, but as we were talking before we started filming today, Corey's has merged into mine, so we thought, why not have you on again? So thank you again I know this is a busy time of year for you, so thank you for carving out some time today to record with us. And Caprice, before we dive into health insurance, because it's a very hot, very popular topic that comes up with our client conversations, for our audience that does not know you, do you mind sharing just a little bit, a brief background of kind of where you're from, where you grew up, and why you got into health insurance and what you do?
Sure. I actually grew up in Ontario, Canada. And from Canada, I went to school, got my master's in health administration. And then I moved overseas, lived over in Asia for about 10 years. And then I moved into the US. This was in the late 1990s, early 2000s that we moved into the US. At that time, went back and got my education, my master's in education. So I really love healthcare and I really love education.
Awesome.
Fast forward, along came the Affordable Care Act. I wanted to find something to do. My children were growing up. And so I thought I would get involved in the Affordable Care Act. It was bringing opportunities back in the late, it's about 2009, 2010 timeframe. And a lot of people needed help. They didn't understand what was coming. So I got involved in health insurance. I have been now doing it for 13 years. My market is the individual under 65, as well as the Medicare market. And I do some small group plans. And have got a lot of enjoyment from it. I have great clients and been very rewarding. So good feel for me.
That's awesome. Well, thank you again. And that's perfectly aligns with our clients who are retiring prior to 65 or after 65 on Medicare, certainly. About how many, and I don't know if you don't know this, how many clients do you work with approximately?
Oh, I would think overall I have now. You have to remember, a lot of this is residual income that gets. So I would think I have about 900 clients right now.
Yeah, that's a lot. And are they specific to Kansas and Missouri, or do you have them all over the country?
I am licensed in 22 states, but I primarily focus on the Kansas and Missouri markets. This is where most of my business is. This is where my referrals come from. And I know this market the best, although I do help across the country in those other states.
Awesome. Awesome. And how about this for a quick icebreaker before we get into health insurance? What is your favorite fall activity?
Well, my favorite activity today is pickleball.
Nice.
Pickleball, right? So I've been playing a lot of it. I love playing outside, although it's getting a little colder. We're moving inside. I also like to do a lot of hiking. And it's great in the fall with the trees changing. So.
Yeah, good for you. And we need to have you out to our pickleball tournament we have every year then.
Oh, well, I can't believe how much I love it.
Good for you.
Very addictive, I have to admit.
You know, somebody told me that's the fastest growing sport in America the other day.
It is. It is.
Yeah. So
because anybody can pick up. So it takes 5 minutes to learn the game.
Good. And Corey, being a big tennis guy, he loves that. He loves
well, I'm not sure if the tennis people like the pickleball people too much. We're taking over.
So, I think they can all live in harmony.
I think it's good. I think it's good. I think it brings more awareness to tennis in general. You're right, though. They are converting tennis courts into pickleball courts, so there's less tennis courts now.
That's right. So, Yeah.
All right, good. Well, thank you again for joining us. Okay, so for today's conversation, I wanted to start with people prior to age 65 and talk about what their options look like as they approach retirement as far as healthcare. Because a lot of people, when they first come to me and Corey and our team, they say, I'm only working because of health insurance, because they think that they have to work in order to get health insurance benefits, or they think health insurance is going to cost them $3,000 a month and they don't want to pay for it. So can you kind of walk us through what those steps look like as somebody's approaching retirement and they're under 65, what they should be thinking or considering?
I often get that type of situation, especially they're 60, 62, 63 years old. They want to retire. They have other plans that they want to do. So, but they're not really quite sure about what options are available to them. And as you said, a lot of them are worried that they won't have coverage. But that's no longer true because of the Affordable Care Act. So I think the most important thing is just to understand your options before you make any decision. Most people know they'll have COBRA, and they get that for 18 months. So that's always one option. But today, because of the Affordable Care Act, individuals can potentially purchase a plan through healthcare.gov. Here in Kansas, we use the federal exchange as well as in Missouri. And there's no longer any caps on your income. The plans through healthcare.gov meet the requirements of the Affordable Care Act. So they have to cover 10 different essential benefit categories, including covering all pre-existing health conditions. And that's a big issue, especially somebody who's in the late 50s, early 60s. More often than not, they'll have a health condition that they want to make sure that they get covered. But purchasing a plan through healthcare.gov will cover those pre-existing conditions. Today, there's no longer any caps on your household income. Nobody pays more than 8.5% of their income towards their health insurance policies.
Is that new? Because is that part of the Inflation Reduction Act, or has that always been the case?
It's been the case since 2021.
Okay, so pretty recent, yeah.
It was the American Rescue Plan, right?
No, this was before. This happened when President Biden went into, he removed that cap on the household income. So even if you have a couple, I just did a couple last night, they're making over $200,000 and they still qualified for a house subsidy. Okay.
Wow.
And there's more and more companies competing in the marketplace today. In Kansas now, we have 6 carriers competing in healthcare.gov. Missouri, there's 7. You have to be aware of, though, in the marketplace, these plans are, their networks are a little bit more restricted than probably what you're familiar with on an employer plan. So you have to choose the carriers that your doctor's in. So you got to do your research before you enroll. You want to make sure your doctors are in it, your drugs are on the plans. And when you also purchase a plan, you also want to understand what your needs are. So if you're really healthy and you hardly use health insurance, looking at those bronze level plans are great. But if you're somebody who's going to have surgery next year or takes expensive medications, you're going to want to look at the lower deductible plans that will cost more, but they're going to give you the coverage that you're going to need. Up until this fall, if somebody got employer coverage, so one of the spouses had employee coverage, healthcare.gov would not allow the dependents to go through the marketplace to get a subsidized plan. The law said that if the plan was affordable for the employee, then that's all that was required. Didn't matter what it cost the rest of the family. But that family glitch has been corrected as of this fall. So if an employer offers employer coverage and it's affordable for the employee, great. But if it's not affordable for the rest of the family, and affordability means that the household plan costs more than 9.1% of that household income, then the dependents can now go into healthcare.gov and qualify for a subsidized plan or advanced tax credits. And advanced tax credits is just the government is paying up front for a portion of your health insurance based on your estimated income for the year that you're in. There's no look back, it's the year that you're in. And so it's just opened up it's just now making it more affordable for a lot more families.
Wow. So let's break that down into, like, if I'm understanding this correctly. So let's say you've got Tom and Susie, right? A married couple, and they've got 2 kids, and Susie still works, right? And so she has health insurance through her employer, but Tom does not.
Right.
So now you're suggesting so what were you saying? So if Susie's health insurance is over 9.1% of her income for the family plan, that they can go now to the marketplace and get a cheaper plan where before they couldn't do that?
That is correct.
So let's say Susie only makes $50,000 a year. So you're saying if her family health insurance is over $4,500 approximately, then she could qualify for, and that's Einstein, by the way, in the background, but she could qualify for
advanced
her
tax
family.
credit.
Yes. So I hear him that correctly?
You are hearing that correctly.
That's awesome. That's quite a change, isn't it?
It is quite a change, because often I'd get people call me and I'd have to ask, well, are you offered employer coverage? And they would say, yes. Well, how much is it costing me? Oh, it's costing me, well, the employee, it's affordable because often the employer will pay 50% of the employee's insurance, but they don't contribute to the rest of the family's insurance. So then, unfortunately, the rest of the family had to go on that employer plan or look at some other option, but that's not the case. So it's just good news for Americans.
That's great news. Yeah. So how does someone engage with your, because this is a lot, Caprice, obviously, and it obviously pays, in my opinion, to have someone like yourself that's in tune with all of these changes and updates on a daily basis. So when a client or a potential client reaches out to you, what do you do? Do you have like a 2-step consultation? Like that's kind of what we do at Falcon Wealth Advisors, but what does that process look like to answer some of these questions for someone?
Usually when somebody has, we'll just make an appointment. I send them my calendar and then we'll have a conversation. We either do it through Zoom like we are right now or in person. So I can better understand their needs. We talk about what their options are, and then they can decide what they would like to do. The big thing is just to understand the options. Health insurance is expensive. So you got to, affordability is important, but knowing what your options are, and just don't assume this is the only option that you have.
Right.
Yeah. So
that's good.
Yeah.
And obviously, to make that meeting most productive, they should come to that meeting with all of their current benefits package if they have one. That way you can help guide them on, because if you don't know, if you're not familiar with the company they work at and their benefits package, then you're going to need to do some fact finding. So if they can bring that to that meeting, I'm assuming that'll help make it more productive.
That helps me a lot, because to be honest, most people don't even know what they have.
Right.
They don't understand their insurance. They just enroll into their insurance. Don't know what their deductibles are, what their co-pays are, their max out of pocket. They don't know. It's just pretty common in insurance.
Yeah, it is. So that's good. So Corey, did you have a question for Caprice, or did she already address it before we flip over to Medicare?
Well, Caprice, you talked about how there's the subsidy income caps were removed, but I know on the show that I hosted recently, we talked some about the Inflation Reduction Act. And I think correct me if I'm wrong here, but what I think it's important for people to know is that those subsidy elimination, that income cap that was eliminated, the Inflation Reduction Act ultimately extends that subsidies out for several more years, right?
That is correct. You are correct. Yes. Initially, when it went into effect, it was for a couple of years, and then it just got extended to 2025 with this Inflation Reduction Act. So
yeah, which is I think that's consumer friendly, right? And I know we talked also about how in years past for a lot of people, and right now there's the discussion around, are people understand that they're going to get their cost of living adjustment from Social Security? Someone's already retired and collecting that. But in prior years, the cost of Medicare has oftentimes effectively canceled out any cost of living adjustment. But that's really not the expectation for next year, correct?
That is correct. That is correct. Actually, things in Medicare went down. The premium, the deductible. So that's good. So lots of good changes in the health insurance field, especially over the last 10 years. I remember when up to a couple of years ago, I'd get couples coming in here and they would be retired and they'd be making, I don't know, $70,000, $80,000 through their investments and through their Social Security. unfortunately, they were never able to qualify for advanced tax credits because there had always been a cap on their income. It's always capped at 400% of the federal poverty level. So for a couple, it was around 65,000.
Yeah.
So then you had these couples who were retired and they were 60, 61, and their insurance was costing them $2,000 or more, and there was no way they could do it. So, but that's now changed. So that's perfect.
Good. That is a good thing. Yeah. Yeah. So you kind of brought up Medicare a little bit. So let's flip. So for our clients that are 65 or older, do you mind giving kind of a high overview of Medicare and maybe some do's or don'ts that you've come across? Because I know you're literally helping hundreds of people. So maybe you can kind of share some tips with Medicare.
Sure. First of all, Medicare is a federal program that's been around since 1965. Most people who are 65 or older are eligible to go into the Medicare market. Although if you had been on long-term disability for 24 months, in the 25th month, you go into the Medicare market, or you have end-stage renal failure. Medicare, traditional Medicare is made up of two parts. Part A is your hospitalization insurance, which covers inpatient hospitalization, skilled nursing, and hospice care. If you or a spouse have worked for 10 years or 40 quarters, there's no cost to Medicare Part A. Somebody who's just immigrated to this country and hasn't worked can still get Part A, but they're going to have to pay for it. Part B is the medical insurance, and that's like your doctor visits, your diagnostic testing, your ER, outpatient surgeries. Medicare Part B does have a monthly premium on it. In 2023, it's going to be $164.90 a month for most Americans. It's going to be based on household income. So as an individual, if your income is $97,000 or less, you'll pay $164.90. As a couple, it's $194,000 or less. Now, if your income is higher than those dollar amounts, the government puts an income rate adjustment on that to that Medicare Part B premium. So you'll pay more. And there's about 5 tiers depending on where that income falls. And there's a 2-year look back on that. So
quick questions here, Caprice, if you don't mind too. So sure. Going back to Medicare Part A, if your spouse has never worked, do they still get it for free as long as you're married?
Yes, that's correct.
Okay. And then on Medicare Part B, do IRA distributions count towards that income threshold?
Yes, anything you pay tax is adjusted gross income.
Okay, got it. So, okay, good. Yes. Please go ahead. Yeah, just wanted to clarify that for the audience. So good. Please.
Yes.
Yeah.
No problem. So a lot of times I'll have a client come in here who maybe just got a big bonus or they sold a business. So they'll get their initial determination for their Medicare Part B from Social Security. But if you have a life-changing event, say you're retired or that was a one-time, you can always submit, there's a form that you submit to Social Security to have them to reconsider the determination based on what you think your income is going to be for that year. So I've had clients come in, just what I want to stress is you can always appeal initial determination. So when you first get your initial determination from Social Security based on the look back period, if you disagree with that, you can appeal it. There's a form that you have 60 days to appeal it and request them to revisit that. You would have to provide documentation that you're retired or your income is going to be this next calendar year. Okay, so work with the financial advisors on that.
Yeah, good to know. Absolutely. Yeah, perfect. So we got Medicare A and B, and then what else do we have? There's a lot.
So now we have Medicare A and B. That's known as traditional Medicare. Now, Medicare doesn't cover prescriptions, so you would buy a Part D drug plan. Now, Medicare says a Part D drug plan is a voluntary program, but if you don't buy a Part D drug plan, you're going to be penalized for every month you don't have credible drug coverage. And this penalty is 1% of the national average of a drug plan for that current calendar year. And that penalty is accumulative. So say I have clients who don't take medications and they'll say, why do I want to pay for a Part D drug plan? I don't take medications, or if I do holistic medicine. Well, fine, that's your decision, but the government will say, you're going to pay a penalty for every month you don't have it. That's a cumulative penalty and it gets added to a premium of a plan in the future. So I've had clients who might be 80 years old. They have never had a drug plan. All of a sudden they have cardiovascular and they're taking some expensive medications. And now they have to buy a drug plan to help cover those drug costs. But then their premium, they just have a $60 added penalty being added on to that premium for the rest of their life.
Wow.
So it's good to have a drug plan, even if you're not taking any medications, just to have credible drug coverage.
What's it normally cost? What's Part D normally cost somebody?
It depends on somebody's medication. So I'll look at people's drugs, and this is the other thing, you should review your drug plan every year. But when you choose a drug plan, every carrier will have a different formulary. There will be some more basic formularies and some more comprehensive formulary plans. So the lowest cost plan next year is $2.80. So it's a very basic formulary. And then at the other end, you have plans that are $80, $90. So really specific to somebody's particular medications.
Got it.
So far we have A is hospital, B is medical, D is drugs, C is a Medicare Advantage plan. Medicare Advantage plans are government-sponsored plans, but they're an alternative way to get your Medicare benefits. So instead of your hospital medical claims going to the federal government, they go to an insurance company who has a contract with Medicare. When you enroll into a Medicare Advantage plan, one of the questions I always get is, do I have to pay the premium for Medicare Part B? Because I'm in an Advantage plan now. Yes, you always have to pay the premium for Medicare Part B, but when you go into an Advantage plan, what happens is you pay your Part B premium to Medicare, then Medicare turns around, pays that insurance company to manage your Part A and Part B benefits.
Oh, interesting. And you just pay the difference then if it costs more?
Yes.
Got it.
Sorry, I don't quite understand that question.
Well, so C obviously costs something too, since it's through an insurance. So don't you have to pay for Medicare Part C, the Advantage plan?
Most of the Advantage plans in this area are zero premium plans.
Oh.
Some of them you can add riders, and in the past, you could add riders for dental and fitness, but today most of those plans built that right into those plans. So most of the plans are zero premium plans. So the difference, so there's two options to get your Medicare benefits. Option one is you stay with original Medicare. Your claims go to the federal government either under Part A and Part B. But Medicare is not a foundational insurance and is not expected to cover all your out-of-pocket costs. There's deductibles under Part A and Part B, and there's co-pays and co-insurance. A co-pay is a fixed dollar amount. Co-insurance is a percentage of those medical bills. And Medicare has no caps on their out-of-pocket costs. So when you go with original Medicare, you're going to buy a Medicare supplement plan known as a Medigap policy. It's a secondary plan that fills those gaps under original Medicare on approved claims. So Medicare supplement plans have a monthly premium on it. So if you go with option one, which is original Medicare with a supplement plan, if something happens to you, you paid up front for your care because you have original Medicare and then you have the supplement to come up to pick up the out-of-pocket costs. So you're paying up front for your care, regardless if you use your insurance or not. When you go into a Medicare Advantage plan or Part C, most of those plans, as I mentioned, are a zero premium plan. You pay as you utilize the Part A and Part B benefits. So Advantage plans are more like employer coverage. They are calendar year plans. They will have a network. They will have a max out of pocket per calendar year. So you will pay either co-pays or a percentage of a medical bill if you go into an Advantage plan until you reach your max out of pocket. So for example, if I go into a Medicare Advantage plan, which are great, and they're the fastest growing, 50% of the population will be enrolled in Advantage plans next year.
Wow.
Just because they offer, it's more comprehensive. Everything is built into this plan. You're getting your hospital, your medical, your drug plan, you're getting your fitness membership, you're getting your dental, your vision. So people like that. Plus, it's not costing them anything.
Right. Right. I thought there was a cost, with this Medicare.
There's no cost to it.
Why, why wouldn't you do it? So why are people not doing it?
Oh, that's a good question. People often, why would I do one over the other? Well, there's not one better than the other. If I went with option one, and if I have a lot of health conditions, or maybe I'm somebody I just don't like to take risk, right? I don't know what the future brings. My health could change tomorrow, right? I want to stay with the original Medicare and have a supplement, and I'm comfortable with paying that. Okay. So that would be the reason why somebody would go with option one. It happens all the time. People who go with option one, again, they're worried about what happens if I go into an Advantage plan and tomorrow I'm all of a sudden diagnosed with cancer. Can I get back into option one knowing that with the original Medicare and a supplement, my chemo treatments are going to be covered 100%? Well, supplemental plans are underwritten plans. So if you start with an Advantage plan and you end up having some serious health conditions and you want to go back to original Medicare and get a supplement, you're going to be declined.
Right.
Because no insurance company, these supplement plans have nothing to do with the government. There's just private plans you purchase.
Right. They're not going to want to pay it. Right.
They're not going to want to take it. So people think about that and they think, well, tomorrow I don't know. So I'm going to buy a supplement and I'll stay there because it gives me peace of mind. Plus, original Medicare has no networks. Therefore, supplement plans have no networks. I can see any Medicare doctor in the world, in the country. So if I want to go to the Mayo Clinic for a second opinion or MD Anderson in Houston because I have a rare cancer, I can do that with option one. Option two, I'm going to be out of network. Okay, so they won't cover you then, and therefore you're going to be paying for that on a lot of the plans.
So then why would someone go to option two? Why is option two better for some people?
Option two is, well, the max out of pockets on the Advantage plans are coming down. A couple of years ago, but it's going to be specific to where you live too, because the option two, they're Advantage plans sold by private insurance companies. So they will design the max out of pocket, I believe, is $7,500 or less per calendar year. It depends on where you are because there's service area specific. Depends on your zip code, what plans you can purchase. Okay. In the Kansas, Missouri area, most of the plans today with broad networks have a max out of pocket of $3,600, $3,700, $3,800. So the max out of pockets have come down. So a lot of people think, well, that's not that bad, especially if I've been in a marketplace plan when I was under 65 and I had a $9,100 max out of pocket.
Right.
Well, $3,800 is not bad at all, right? So more and more people are going that way because the max out of pockets are coming down, the networks are getting better, more added benefits are being added to those plans, right?
But could that person go to Mayo Clinic or no? Would they have to pay for it all out of pocket?
Some of the carriers will allow you to do that. Depends on the carrier that you enroll into. So some of them do have national networks that will allow you to see any Medicare approved provider outside of their network, but you're going to pay more. You might pay 40% of the cost versus if it's in network, you might pay $295, right?
Got it.
So some of the carriers will have a max out of pocket for out of network, just like your employer plan will have an out of network max out of pocket. So that's why more and more people are going because these networks are getting better and they're giving you more flexibility. In the past, a lot of the advanced plans were HMO networks, which means you did not have any out of network coverage.
Gotcha.
So an HMO is a health maintenance organization. You had to choose all the providers in the network. One of the questions I often get, I don't want to go into an Advantage plan because I want to be able to choose my own doctors, right? And I don't want to have referrals. Well, most of the plans today don't require referrals. So even if I'm in an HMO network, I still don't need to have a referral to see a specialist as long as that provider's in the network. So that's the understanding on the Advantage plans these days. If I'm in a PPO network, and a lot of the carriers now offer that type of network, which gives you in and out of network coverage, although there'll be some local networks and some national wide networks. I don't need any referral in or out of network. So it's just, so when you go into an Advantage plan, the important thing when you choose it, if that's the direction you're going, and I'm not saying there's one better than the other, everybody has their own particular needs.
Right.
And I can tell you have to understand your needs and what's important to you and what your health care situation is. Okay. But I help my clients evaluate that, try to make them understand the difference between the two options.
That's a lot, Caprice. I mean, even though it's gotten better, it hasn't gotten any simpler.
And moving to Medicare is very confusing at the beginning because there's so many letters there's A, B, C, D. What's this G, N, K?
Right.
So it is a very confusing time. But my big thing for my clients is making sure that they understand the difference between the two options that are available with them, what the advantages and disadvantages of both of those options are, so they can make the best decision for their particular situation. Because what you do and what I do, it will depend on your particular needs and my particulars. There's not one better than the other. You're going to choose one that fits your needs, lifestyle, and budget, right?
Got it. Yeah, that's good. So that's so as we wrap up today's show, a lot of clients will ask too, how are you compensated, Caprice? Because you're obviously an expert, in my opinion, of what's going on here. So people want to come see you. How do they pay you for your services and your time?
A very good question, and I get that all the time. So I'm an independent broker. So I contract with the carriers, and they pay me a commission by enrolling them. And if my clients continue to stay with me and stay on those plans, I get renewal commission as well. So
got it.
Income. So
but
my service,
someone doesn't have to pay you a check out of their pocket or anything. You're getting compensated based on what plan they pick.
That is right. If I enroll them, but my whole thing is I want to make sure if they don't enroll with me, great. At least they walk away from me understanding their options. So when you choose somebody that you want to work with, I mean, you can always do it yourself, but working with somebody helps to make the process easier, less frustrating, and less time consuming. Plus, you always have an advocate. If you have a problem with the carrier, I'm able to get into the carriers to talk with them. I just had a client the other day. She went to fill a prescription plan. Her doctor had ordered this medication and the pharmacy wouldn't fill it. So she was really upset. So she calls me up and she says, I got to change my plan. They're not going to cover my drug that I need to take. The doctor's over. So I said, well, let's do a conference call. We called up to the pharmacy with the carrier pharmacy. And we found out that the reason why that they wouldn't fill her prescription, why they wouldn't approve CVS to fill that prescription, was because of the interactions between her other medications with this new one. So we were able to get that resolved. They're going to reach out to her doctor. The doctor will authorize it and then they will fill it. So I'm there more also as an advocate to be there when my clients have problems so I can work with the carriers. Yeah, I love what I do, and I'm happy to consult.
Yeah, no, you could tell, and thank you, Caprice. That is wrapping up on the time that we have for today. But I know this is a busy time of year because it is open enrollment time, and so if any of our clients or viewers want to reach out to Caprice, I can certainly share your contact information. They just have to contact me at jake@falconwealthadvisors.com, or certainly Corey at falconwealthadvisors.com. But any parting comments, Caprice? This was a lot of information. Thank you as always for being on the show. We could talk all day about this stuff, but any other parting comments?
I do want to mention one thing, if I may.
Please.
One of the questions that I often get is, do I have to enroll into Medicare when I'm turning 65 if I'm still working? Okay. My answer would be to look at their options. No, you do not need to enroll into Medicare if you have credible medical and drug coverage through the employer. And credible coverage means that employer has 20 employees or more. Therefore, that employer plan is considered to be primary insurance, and you do not need to enroll into Medicare Part A and Part B. You can enroll into Part A. It's free to you at turning 65, but you do not want to enroll into Part B if you have employer coverage, because you don't want to have to pay that premium. But the other hand, you will want to look at what it's costing you to be on that employer plan, what your deductibles are, what your max out of pocket, and compare it to what it's going to cost you in Medicare. So again, just doing your due diligence. And that's my party.
That's really good. And then as another good quick point to wrap up our piece of it, this is what we do. So we'll refer clients to Caprice normally to crunch all these numbers and then figure out what is it going to cost you. And then Corey and I and our planners will plug that into your financial plan so you can see how your decisions will impact your long-term retirement goals. And so that's why it's so critical, in my opinion, to work with a professional on your health insurance so that you can get the right coverage that makes sense for you. Because as you can tell, There is no cookie cutter, one size answer for everybody. So let's get that health plan really figured out and understood. And then let's plug that into your financial plan and make sure it all works together. So thank you again, Caprice, for joining us. Thank you, Corey. I know you didn't get much question. We would like Caprice to just have the mic and go with it, because that's
good. I still learned a lot.
Yeah, exactly. So thank you all for tuning in as always, and we hope you have a great week.
Thank you for listening to Upticks. Click the subscribe button to be notified when new episodes become available. Also, be sure to visit our website, falconwealthadvisors.com, and click the Contact Us button if you'd like to meet with Jake and his team.